And John, my apologies. I didn't realize that. Well, everyone, apologies for joining a little late. But I think, Marianne, if you're ready, we'll go ahead and get started. So I want to welcome everyone to the September grant session of Grand Rounds for the Philip R. Lee Institute for Health Policy Studies Grand Rounds series. These are monthly series of talks on policy relevant topics. It's my pleasure today to introduce Professor Marianne Bitler. Professor Bitler is a professor at University of California, Davis, an economist by training. And she is taking a sabbatical with us here at IHPS for this, I guess, about half a year. And, you know, it's been a bit of a virtual sabbatical, which I know Marianne has been a little different than your typical sabbatical. And just a minute here. Okay, I'm having apologies. I'm having a little bit of a Zoom issue. Marianne, if you put your slides up, I think we'll finish the introduction and go ahead and get started. And so, yes, Professor Bitler is in the Department of Economics and the Center for Poverty and Inequality Research at Davis, member of the NBER. And she's going to talk to us today about the impact of nutrition assistance on child and family health and nutrition. And her talk is part of our effort at IHPS to go, beyond medical care, to really looking at the other social factors that affect people, including nutrition, and the impact of policies on health. So with that, please take it away, Dr. Bitler.
Thank you very much. So I'm excited to be here today. And first, I wanted to thank IHPS and Joanne and Janet for as good a virtual sabbatical as one could possibly have. I've gotten to meet a lot of people that I didn't know, and I got to work a little more with some people that I'm already working with. The second thing I want to do is acknowledge that the work I'm going to talk about is with a ton of co-authors, including some people on the call. So I'm not going to stay here very long, but just so you know, it's based on a wide variety of co-authored projects. And then I want to acknowledge the funders briefly. Right. And also,
Marianne, I just read one thing, folks, I forgot to do. If you have questions, please put them in the chat. And then after Dr. Bitler finishes her talk, I'll help her go through the chat so that we'll identify questions to answer. So if something, pops up, just throw it in the chat and we'll discuss later.
Great, thanks, Janet. And just to note that this work doesn't represent anyone's opinion, and any results that I show you from restricted use data from NCHS have been reviewed and for disclosure, okay? So I wanted to just start off by giving you my perspective. I'm usually sitting in an econ department, and so that means I think I have a slightly different perspective than some of the folks in the room who work on these programs. And so as a public economist, there's a lot of focus on in my research on take-up of programs within our very patchwork safety net in the US. And one important question that economists in public economics care a lot about is this idea of incomplete take-up, which is not everybody who is eligible for programs uses them, and to understand more about why whether that's a function of what behavioral science suggests, which is limited bandwidth, and the worst off people are probably the ones not getting the programs, or as economists in the past, the typical neoclassical view was that this was efficient, which I know probably sounds kind of fascist to most of the people on the call, but the idea is it would deter people who didn't really need benefits from using them. I'm also increasingly interested in this question of administrative burden, which I'm not going to, comes more from other settings. And then, of course, unintended consequences and spillovers of programs. As you probably know, economists tend to prioritize design and causal interpretation over other things like importance of the question. So we think it's a feature, but some people think it's a flaw of economics being rather narrowly focused. And so in this desire to avoid things that can bias your causal interpretation, the stuff I'm going to talk about today is based on regression discontinuity designs, interrupted time series, event studies, and then I might mention staggered adoption, and also a little bit about cycles. So our safety net is a mess. So Europe has these coordinated systems where you start getting benefits as soon as you lose your job because they're all connected. We have this mix of various means tested in other programs that include cash, in kind, human capital investment, and tax expenditures like the earned income tax credit and the new child credit, and the old version of the child credit rather than transfers. And in addition to being somewhat patchwork with all of these different programs with different concepts of what income is and different places you apply, a lot of these programs are fairly decentralized. So at a minimum, states, but sometimes counties are setting policies as well as the federal government, and there are complex interactions. Furthermore, some of these programs are run by nonprofits. So relevant for today's talk, that means school meals and WIC, which are run by schools and WIC clinics, and others are run by governments. And then there's also this feature that for school meals and which I'm going to, well, for WIC anyway, which I'm going to talk about today, that the private actors also matter. So stores are a relevant, important feature of WIC and SNAP as well, because if there aren't stores that are participating in the programs, people can't use their benefits. So food assistance in children, these are sort of the big programs. So SNAP, which I'm mostly not going to talk about today, but do work on, this is a little bit about it. So WIC, which I think many people already know about, but I'll tell you a little bit. It's a means tested program for pregnant, postpartum and breastfeeding women or children under 5 who are at nutritional risk. And to be eligible, you have to have family income under 85% of the poverty guideline, or you have to be on SNAP, TANF, or Medicaid. And it used to be vouchers. Now, almost every state's on EBT, maybe every state now. California just went through the process of changing to e-WIC, and you get these vouchers or EBT benefits for specific foods that are high in nutrients of concern. It's an important program, particularly for immigrants, because unlike a lot of other programs, except for the state of Indiana, nobody's going to ask you about your immigration status, and you're eligible regardless. And it also provides, importantly, not just food, but also nutrition education and breastfeeding promotion. The school meals are also means tested, although there's a smaller subsidy for the universal program. And they also have this family income cutoff for free or reduced price meals. And SNAP also confers automatic eligibility for school meals. And again, there isn't a constraint about citizenship status of kids or their parents. And then there are some requirements for the types of meals that have to be served. There are also other child nutrition and food distribution programs, but they're considerably smaller, with the caveat that during COVID, first of all, there was pandemic EBT, which was cash payments to replace school meals. Second, there was a big expansion of the kinds of summer feeding programs where kids can just pick up meals and go. And there were a whole bunch of waivers to allow people to participate in these programs without always having to go in person. Okay, so how big are these programs? And I'm going to focus on WIC and school meals for the rest of this presentation. So in 2019, WIC had 6.4 million people participating, with about $41 a month in food costs that the government paid. And then there's some extra value to the participants who are getting formula from rebates. And there's a cash value voucher for fresh fruits and vegetables. In 2018, only 57% of eligible people participate, and this number is much lower for kids. And WIC is not fully redeemed. The benefits expire at the end of each month. And so, that makes it a little harder to use. And the fact that it's specific items that you can buy with it also means it's a little harder to use than, say, SNAP, where you can use it to buy any non-prepared foods. So this is not a huge program in terms of dollars, but it's a pretty big program in terms of how many people it touches. Around half of pregnant women and more than half of infants are participating in this program. So in one way, it could be you can think of it as a very big program. School meals, and here I mean the school breakfast program and the national school lunch program. About 30 million kids got lunch every day, and about 3/4 of them are getting hot lunch every day at school from this program, and about 3/4 of them are getting free or reduced price lunch. It's considerably bigger in total dollar terms. And if you take these numbers and divide it by the number of participants and 9 months a year, it's about $53 per month per participant in cash. Okay. The breakfast program is smaller, but it's also more targeted, so it's more participated in by free and reduced, less well-off kids. And then the recent thing here, which I have not done any research on, but it's been the source of a lot of exciting research, is the new community eligibility provision, which says schools can choose to feed everybody in the school for free if they have sufficient kids participating in means-tested programs. And there were some older provisions that also allowed schools to do this that have been less studied. Okay, so I'm going to broadly say what the econ literature thinks about these programs, which again may not entirely accord with what everybody in the room thinks about them. So, to the extent that these are mostly national programs, they're hard to evaluate because it's hard to find a control group. WIC has mostly been associated with positive effects, especially for infants. I would say one characteristic here of the economics literature and other more causal oriented literatures on this is that the quasi-experimental estimates for the effects of the program are smaller than observational comparisons. However, one thing people have thought in the past was, well, WIC is positively selected into, but at least in my own work, I don't think there's much evidence of positive selection into WIC. That is, I don't think better off people are choosing to participate in WIC amongst the set of people who are eligible. School meals programs have been shown to have some long run effects from when there was a big change in the National School Lunch Program in the 60s. There's plenty of evidence that free meals have good impacts on kids' meals and also on sort of some educational outcomes. And then there's some work by Diane Schanzenbach that raises questions about healthful eating associated with the National School Lunch Program. Okay. So now I'm going to just briefly touch on some different kinds of sources of variation that I and team members have made use of. So one is this e-WIC rollout. So as you may know, California recently implemented e-WIC starting sometime in 2019 and through the pandemic. Other states implemented this program at different times. As is typical, California is one of the last states to implement one of these mandates that you go to electronic benefits. And the fact that there's this staggered adoption across locations means you can use a difference in difference or interrupted time series design, where you can compare changes in places which adopt e-WIC with changes in places that don't. And that allows the non-adopters to provide a counterfactual to account for other shocks. So with a team, which is probably a third of the audience today, from UCSF and Charlotte Ambrosek, a great grad student at UC Davis, we're using national birth certificate data, which has self-reported WIC use, to look at how EBT rollout affects take-up and outcomes by pregnant women. And so far, we found evidence of smaller increases in take-up using this within state variation than some of the other published work. And with some colleagues at UC Davis, we're also looking at redemptions for WIC as a function of the rollout and not finding effect of huge impacts, but some evidence of positive impacts, so that this program, electronic benefits, which should have, the theory is it has less stigma because people can't necessarily tell you're using WIC, and it's also maybe easier to use, would lead to people either using more of their benefits or more people being on the program. The other change about e-WIC is that you could break up what you redeemed into different chunks. So it used to be you had to redeem all of a particular part of your package at once, and e-WIC allows you more flexibility. So people might redeem more even if nobody else is on the program because of that feature. Okay. A second source of variation that some of my work uses WIC to look at is the WIC cycle. So, there's extensive evidence of the SNAP cycle and other cycles, and people in the room, again, have studied this more than me. But, we know that there's evidence of systematic responses in terms of what kind of food people acquire, and also calories and other outcomes like from hospital records from Hillary's work when benefits are paid out. But there hasn't been much work on WIC, at least not that I know of. And so this is going to use data from Nevada and eventually Utah. And this is work with Jason Cook, who's an economist at Utah State. And so this should say Nevada. Nevada distributes WIC on the first of the month. And interestingly, unlike SNAP, which most people exhaust and you see this big jump at the beginning of the month, we actually see changes in redemptions at the beginning and the end of the month. So this graph is the density by day of the month of redemptions for various foods. So if you take this top left corner, you see adult cereal. So you see that there's a bit of a bump on the very first day, and then it goes down, and then it kind of trends up again at the end of the day. Okay. Similarly for cheese and eggs, both kinds of infant formula. So I don't even know what exempt infant formula is, but regular infant formula, that one is overwhelmingly at the beginning of the month, okay, because people want to get it for the whole month that it's available. But for a lot of these other things, and I would guess, interestingly, fruit and vegetable CVV is also disproportionately at the beginning of the month. but a lot of these other things are showing 2 peaks. And so that seems interesting and different from what you might have expected if you didn't take into account this idea that you can exhaust the benefits. So what we're hoping to do with Nevada data is to maybe be able to understand more about who these patterns are for. With the Utah data. With the Nevada data, they wouldn't give us any personal identifying information. So while they were happy to share this, we couldn't get anything else out of it. But we think it's fruitful for looking at some other outcomes for families where this pattern is particularly pronounced. I'm also going to mention some work with Jason and other folks at Utah about why people don't take up programs. There's a survey that was being done in Utah during COVID, and we added some questions about whether people had obtained unemployment insurance, SNAP, and the economic impact payments. And then if they didn't get those programs, we wanted to understand more about why they didn't get them. And so we had a variety of options. You could check more than one, but we were trying to sort of tease apart stigma. This program isn't for people like me. From information, I don't know about the program. Lack of eligibility, I said I wasn't eligible. And administrative burden, which was, it was hard to apply for the program, okay? And interestingly, these things don't all load onto each other. So it's not just that the same people have each one of these things, which I guess shouldn't be a surprise, but does suggest that they're at least capturing something slightly different. And then we also asked some questions about hardship that we took from the Census Pulse survey. And so if I run some regressions that control for demographics, high income, and receipt of the programs and reasons for why you're not getting them, the first thing to know is the SNAP payments were well targeted. That is, people on SNAP were more likely to report they sometimes often didn't have enough to eat. And then in terms of which non-recipients were needy, not all of the groups were needy, but those that had difficulty applying said that they were worse off on this dimension. Those ineligible were worse off on this dimension, and those who didn't know about the program. So this graph shows you this outcome, sometimes or not often not having enough to eat. And then blue bars are the unemployment insurance program. Orange bars are SNAP, and green bars are the EIP. And in each color represents the results of one regression. So if we were to look at the orange bars, which sort of show the most pronounced effects, that's the SNAP regression. So people on SNAP are about 22% more likely to say they sometimes often didn't have enough to eat. And this was about 20% for people who did not participate in SNAP and did not know about the program. Considerably higher for people who had difficulty applying for the program, and also fairly high for people who were ineligible for the program. Okay, if people said the program was not for me, then they were not any more likely to report sometimes not having enough to eat. I think there's not as much interesting from the EIP program here, but if the other interesting thing to me was in terms of UI, again, program participants were marginally, statistically significantly more likely to report sometimes not having enough to eat. And that was also higher for people who didn't know about UI, people who had trouble applying for UI, people who were ineligible for UI, and people who thought the program was not for people like them, okay? So that's just a piece about the take-up side. And then now I'm going to turn to the bulk of the talk, which will be about 2 different regression discontinuity designs for looking at the effects of a program. So in the first, we're going to use the fact that different places have the school year end at different times and start at different times. And we're going to look at what happens to children and the female adults in their households when the school year ends or starts. And so I think I already said these first 2, but the important thing to know is while there are these summer feeding programs once schools end, they have much, much lower levels of participation in normal times than the school meals program. And part of this is because, if your kids have to be in school and they're there anyway, they're going to eat meals that they're eligible for. But if you have to go somewhere to pick them up, that might be much more unwieldy. The summer feeding programs are also not organized as systematically, across locations as the school meals programs, okay? So when school ends, some kids might be losing as many as 10 meals a week and some plus snacks. And when school starts, kids might be gaining as much as 10 meals a week, okay? So we're going to use a regression discontinuity design. And so we're going to take students either separately at the end of the school year through the summer and compare that to the spring period. Or we're going to take kids at the start of the school year from the summer and compare that to the fall period. Okay, so as typical in a regression discontinuity, you know, there's a running variable, which here is days before school ends and after school ends, or before school starts and after school starts. And the identifying assumption is that the only thing that happens systematically right when school ends is that kids are losing access to school meals. Okay, and so these estimates control smoothly for this running variable. And the idea is there's no reason to think that unobservables should be disproportionately shifting at the end or the start of the school year. So this should give you a valid causal design. We're using restricted use NHANES data. And then we were able to get information on the largest school district within a number of counties and that year's school start and end dates. Okay, so these data are more comprehensive more recently because there are, you know, we were able to find electronic records, and less so for sort of NHANES 1 and NHANES 3, which is in these results. But, you know, we had to submit a revised application because our time ran out on our grant, and we want to sort of focus on the more recent period because we have just much more information about the actual end and start of school. We're going to pool children 1 through 6th grade, 7th through 12th grade, and then overall. And we're going to look at some spillovers to women. And so I think of this as an update to Janet Curry, who's one of the co-authors, Jay Bhattacharya and Steve Heider's work, and Jay and Janet's work from earlier, where they used NHANES to compare kids in the summer to the rest of the year. So the outcomes, this shouldn't be here. I thought I was going to do these in different order, but I didn't hear from my analyst in time about sort of the disclosure stuff. But we're looking at either self or parent, well, for the kids, it's self or parent reports of food consumption, implied nutrients, food security, and HEI, and then a couple different things from the exam, okay? And we have in progress, but haven't completed yet, external data to look at a first stage, or at least the maximum size of the first stage. One of the co-authors, Krista Ruffini, has data from a few states on district level participation in the meals. So we can at least tell how many meals on average you're losing at the end of the year or gaining at the beginning of the year. So I think I said all this. We're using the relevant sample weights. We're clustering by day. We're doing this with a local linear regressions with this bandwidth that's about 80 days or 120 days on the longer end and 52 days in the summer, because that's about the length of the shortest school year. And the results I'm going to show you today are for kids under 200% of poverty. The reason to split out the younger kids from the older kids is school meal participation is higher for the younger kids. You know, kids have a lot less say over what they're doing during their school day when they're in primary school. So an important test here is that there's no, there's no reason to imagine that the sampling should be varying by whether you're at the beginning or start of the year, but we will still want to see, is there anything different about people who we see right before the end of school and right after? And is there more sample on one side or the other? Okay. And so we look at a whole bunch of characteristics here. Does the household reference person not have a high school degree? Is the child white? Is the child Black? Is the child Hispanic? Is the child male? And you know, there are some marginally significant ones here, but the differences are not all in the same direction. So then when we look at the school start, which is a little bit of a richer design, because unfortunately for us, NHANES doesn't do much interviewing over July 4th. So there's like this missing hole in the data for the school end, okay? So kids in grades 1 through 6 have some worse outcomes in terms of these dietary things, and all the outcomes are worse for the older children. Now, given that the participation rate is lower for the older children, that either suggests that, you know, it might be something about an even bigger effect for the older kids, or it could be something, and we hope to tease this out more, about incapacitation. So maybe for kids who are older, it's not so much that they have access to free meals at school, but just that they have access to better meals at school, okay? For school end, for kids in grades 1 through 6, most of the estimates are in the direction of worse nutrition. Only milk is marginally significant, and nothing is significant for 7 through 12. And really, we're facing a bit of a power challenge here. So you would think NHANES, we should have plenty of power, but we need to have kids within, you know, we need to have kids on both sides of the cutoff in the same places. And the way NHANES works, I think many of you know more about it probably than me, but people drive around in vans. And so if we got really unlucky about when the van moved, we might have observations in the summer, but not before, and vice versa. You know, our hope is that when we get our revised stuff in, we will be able to tighten up some of these point estimates. Okay, and then the reason I have these in 2 different talks is because I was facing this challenge with disclosure and I didn't want to get into trouble since this is going to be recorded. So now the last work that I'm going to talk about in, I guess, my remaining 20 or so minutes, I should leave about 10 minutes for questions. Janet, is that right? Okay.
That is correct. And Marianne, while we have this pause, I goofed, folks. I told you to put questions in the chat and not the Q&A. That was my bad. You really should put them in the Q&A section. So please do send us some questions. I have a few, but we really want to hear from you and give you a chance to interact with Marianne.
Okay, so this second paper we're hoping to get out of the NHANES data is thinking about kids and what happens to kids when they age out of access to WIC. And you can see from the title, we're not finding a whole lot overall for the children themselves, but we're finding some changes for the mothers. As I've already said, WIC is one of the larger nutrition assistance programs. And we know that WIC leads to better birth outcomes. But the program provides nutritional assistance to pregnant and to children until they turn 5. And about 3/4 of the WIC recipients are kids under 5. And we don't know anywhere near as much about how they're affected, I think. There's also very little evidence about how other people in their household are affected. And there's some concern by skeptics of the program that just other people in the household might be consuming the benefits. We don't have a lot of evidence about any part of this, okay? And we could imagine, you know, it's probably very salient to women that they are, you know, to parents that their kids are going to lose eligibility at age 5, and maybe parents might compensate in some other ways. So we're going to do another regression discontinuity design where the running variable is aging out of the WIC program. So I already said all of this, I think. I guess the only other point to make is it's a fixed bundle. So you get a big chunk of stuff and you get nothing. There's no phase out, which makes it different from, say, the SNAP program, where the people with some people with more income get smaller benefits. And I don't think there's anything else important here to say. So this just gives you a sense of the WIC food package for kids ages 1 to 4. So juice that doesn't have anything else in it, milk, ideally low-fat milk, breakfast cereals that don't have too much sugar, eggs, the fruit and vegetable voucher, whole wheat bread, or you can substitute tortillas, but I don't think they get redeemed very much, and then peanut butter or beans, okay? And there are some other papers using RD, and they sort of find aging out of WIC leads to worse outcomes. And one other paper actually also uses NHANES, but it's not doing the same thing we are because it's using the public use data. Okay, so our contribution is we are examining a wider range of nutrition outcomes than some of the previous studies. The one other NHANES paper is only looking at the AGI. We're trying to use some objective health measures from the exam and not just things that are self-reported. And we think we're the first to look at spillovers on other family members, and we have better timing because we have restricted use data. So we know the birthday in days as opposed to in months, the way you would outside the RDC. And the reason that restricted use data is important is because in the public use data, you wouldn't know who the women were that were living with the children that are aging out of the program, because you just know about people. You don't know, and you might know that they had kids, but you don't know the ages of all the kids. But with the restricted use data, we have data from the roster, so we can tell if there was a kid aging out of the program for the women who get interviewed. And again, it's a fuzzy RD, just like the previous paper. I should have said fuzzy before. Most states actually stop the benefits at the end of the month the child turned 5. Okay, so not directly on their birthday. Most states don't give you, like, if your birthday is on the 3rd and they give out benefits on the 1st, they don't give you 3/31 or whatever benefits. They just give you benefits for the last month. Okay, so we're going to turn off the WIC variable at the end of the month the child turned 5. We assume there's no endogenous sorting of units around this, and that the conditional expectations of the potential outcomes are continuous at the cutoff. Okay. And so this is the design here. So, we smoothly control for age, and age interacted with being greater than 5. And then the key coefficient is beta 2 on this dummy for your age being bigger than 5 at the end of the month you turn 5. Okay. And I'm going to show you some stuff from the SIPP where we only have age in months, but for the NHANES data, we have the age of the child in days. We're going to use a triangular kernel, which is common in this setting, because then near the actual end of the thing, you're mostly weighting the observations that are close to the discontinuity. We're using the relevant NHANES survey weight. We're using a cubic in age in days. We're clustering at the day of the interview, and we're using a bandwidth of 719 days, which is around 2 years, but we've experimented with some of the more recent optimal bandwidth choices, and they sort of tend to give us bandwidths that are similar. Okay. So what could be happening here? Well, we think the loss of the package could mean just loss of resources. We expect a reduction in consumption of WIC goods and ambiguity about non-WIC goods. And we expect this to affect the kids who age out or to affect other parents, given this concern about adults consuming the child good. Okay. So the first thing we wanted to know is, was there actually a decline in WIC participation right at this age cutoff? And we're going to test that with the WIC participant and program characteristics data, which is a census of people on WIC in April of even years. We also wanted to see, is there substitution to other social safety net programs, and rule that out, and then test for manipulation of use of WIC or bunching at the threshold or something weird about the sample design. So this is a subset of the PC data from, I think, around 96 through 2014 or so. And this is the numerator is the count of people who were this age in April, and the denominator is the number of births total taken from the vital statistics. And so you can sort of see a big drop around 12 months. We'd originally planned to look at 12 months, but you can see that there's also evidence of churning at 12 months where things pop back up after a few months. And then you can see this big drop here at age 5. Okay. So from the administrative data, there's about a 15 percentage point decline in participation at age 5. From the SIPP, this is just one of the graphs of the RD, sort of showing no significant change in Medicaid or SNAP within the household when the kid turns 5. If anything, they both look like they're going up a tiny bit, but not SNAP very much. And this certainly isn't significant, and this isn't significant either. And this is also true for a host of other programs that aren't on the graph. So at least this doesn't suggest that there's a lot of substitution into these other programs. And to be honest, a lot of the people are already on these other 2 programs when they're on WIC. So obviously, if you're already on the program, you're not going to get something different afterwards. And WIC doesn't matter for your eligibility for these other programs. So then the NHANES, I think I've already said everything here, except the household roster, which has the birth date of everybody in the household. And that's what we use to create these spillover samples. So our child sample is only children aged 3 to under 7, where this very crude measure of household income that NHANES has is under 200% of the poverty level. The female spillover sample is adult women in a household where there's only 1 kid aged 3 to 7 that are also low income. And then we plan to refine this a little bit. So we've done some stuff with a child spillover sample. And then we also want to restrict this to look at women 20 to 50 who we think are more likely to be the mothers of these kids. Okay. We're weighting the analysis, and when there's 2 days of dietary recall, we're using the average. Okay. So here are some balance tests for those same variables that I mentioned from the school meals part. So you sort of see not all these coefficients are 0. Some of them are pretty large, but they don't all go in the same direction. So when you're older than 5, you're less likely to have less than a high school degree, which means the household reference person is more educated, but at the same time, they're also more likely to be Mexican, less likely to be male, and a little less likely to be white. If we do an if we do a McCrary test here, then there's not significant evidence of bunching for this child sample. So here are some of the main results. So food insecurity for the children doesn't seem to have changed very much at all. The HEI went up and statistically insignificant, and nothing much is going on in these other dimensions. We looked at many more things, but this is just sort of a taste of what we want to report in the eventual paper. It's, you know, I can't, we haven't disclosed it yet, but if we look at the adult food security for the kids in these families, we do find evidence that's consistent with an increase in moderate food insecurity for adults in the same household as these kids, okay? So here are some graphs now for those of you that like to see the RD in graphs. You can sort of see, here's calories, here's moderate food insecurity for the child, here's milk, and here's hemoglobin. The next thing we did was go to this adult female sample, which is adult women living with these children. The balance is a little bit less good here, although that's not on the slides, but you know, that's why we want to sort of move to analysis where we're sort of reporting results using the child weights for the adults living with the children. So the results then would be representative of the adult females living with the children. Here is just the adult female results. And you sort of see a decline, pretty big decline in calories, an increase that's pretty large in moderate food insecurity for the adults living with these adult females. You know, maybe a little bit of a decline in milk, not much going on with hemoglobin, okay? So to conclude, which I guess we'll have more, well, nobody's ever sat if they have more time, but I guess I went a little faster than I planned. So using this fuzzy RD, we've explored the effect of children aging out of eligibility for WIC at age 5. So we aren't finding any evidence that children are consuming less, but we think this is because mothers are providing a buffer. So women are consuming less as children age out of eligibility and report higher levels of food insecurity. That's the one that's not disclosed, but you know, I can tell you the sign is such that it's an increase in food insecurity when the kids age out at 5. And you know, we think this is important, compelling evidence that this program is making a difference in households of kids, because the program is going away when the kids are finishing their eligibility for the program. And sort of this points out this policy issue of this missing hole. You know, kids can't get school meals until they're in school, and not everybody has started school by the time they turn 5. Now that's less so now that we have more pre-K programs, but not all of those, you know, they have the same challenge in that they provide food during the school year. And so, you know, I think policy implications of these combined two papers are, you know, we should have free meals. Well, I mean, I think it would be good to have free school meals. That this paper doesn't show that, but I think free school meals all the time would be good based on the evidence. And then also having a more expansive free summer feeding programs all the time would also be good. And so that's just a taste of my perspective and my work on these programs. And I can see there's a bunch of things in the Q&A. Okay. Replicating the school nutrition study in NHIS, allowing us to look at food insecurity. I think we've thought about that. This has been the most, I'm thrilled that we could get the data, but this has been a very slow project. So I guess we've been more excited about trying to do the WIC project in the NHIS because there all we need is the birthdays. We don't need to actually merge in the data about when the schools start and end, but we could also, perhaps, I mean, when we apply to get it, the NHIS for the WIC part, it probably does make sense to add it in for NHIS, okay? From Robert Lustig. If 40% of SNAP purchases are SSBs and juice and cereal are numbers 2 and 4, does dividing SNAP by sugar and sugar source alter the effects on health? I think I'm confused by that because this is about school meals and WIC, none of which, I mean, I'm not saying that all school meals are super healthful, but there are restrictions on what you can get reimbursed for in terms of the healthfulness of school meals. So I guess this is just a more broad question about what people spend SNAP on, which I think I know a little less about that. I do think the little bit I know is that the people on SNAP don't tend to be consuming wildly larger amounts of soda or other sugar sweetened beverages than other people that look similar to them and are of similar incomes. How Luft acts about this question. Yeah, there's this challenge, but we don't know what school anybody goes to. So we had to draw something somewhere about the grades. And so 1 to 6 versus 7 through 12 is more about just kind of splitting the sample somewhat evenly, rather than it's definitely going to be mixing up this middle school thing, but there's no way to get around that, because if we did 1 through 5, that would probably be safe, but then there'll be some kids that are in elementary schools we're missing. And so we just picked 1 through 6. We didn't have a particularly scientific reason for that. Okay. Hillary says, well, you can all read it, but I think it's been suggested we should change WIC eligibility for kids to continue into matriculation. I think that this would be a great idea. I'm sure it would be hard administratively, because, you know, it would be difficult for the WIC clinics to verify when the kid had entered school, and there isn't. So I think there would have to be some infrastructure stuff done, but it would be much more straightforward to say, you know, we could have it extend until the time that you would be eligible to enter public school in your state. That seems like it would be straightforward and easy to do. I guess, you know, there's probably some, if you're really concerned about people double dipping, which I don't think is a concern, let me just be really clear. But if you're really concerned about that, the fact that school starts at a kind of different time in different places might make this a little bit complicated. But I certainly don't see any reason not to say you could get WIC until the August of the year that you would be starting school. And then same thing for the WIC analysis. And yes, we're planning to apply for both NHIS and then the national. The survey of children's health has some health outcomes, although I don't know if we've completely decided about that. Oh, never mind, I should have gotten that. And then Dean has a question. The measure is a household measure, but interestingly, it's the 12-month food insecurity. So I think there is other evidence suggesting that, and somebody on the, regarding your aging out of WIC study, isn't the food insecurity measure referring to household level food insecurity? Not clear how child is not more food insecure while mothers are, if the measure is a household measure. I'm sure somebody on the call or on the talk knows more about food insecurity. I'm sure Hillary, at a minimum, probably many other people know more about food insecurity than me, but this food security measure has some additional questions about kids. And so it's possible for it not to be severe child food insecurity, but still be severe adult food insecurity. So some of the questions are things like, you know, did you, they only ask the adults, I don't know if that's what's on this particular, you know, battery of questions, but, you know, did you, the adults, cut back on what you were going to eat? So it's possible for the adults to be coded as food insecure and the kids not. But the other thing to know is that there are some households where there are kids who are aging out that were interviewed, but there's no adults interviewed. And like very rarely it goes the other way. And I think this is something where I'm hoping someone else who knows more about NHANES on the call might contact me later. But from what I can tell, the way they choose the sample, you know, sometimes it prioritizes young children. And so sometimes some other kinds of adults might not be interviewed if there's a lot of young children in the sample. Okay. Question. Would you please educate us a little more about the fuzzy approach of these methods? I'm happy to do so. So the way in which this is fuzzy, so forget about the fact this is hemoglobin for now, and imagine that there was a program that nobody could get on before they were 5, and then everybody was forced to participate in it when they were 5. Then everybody would go from participating at a level of 0 before to a level of 100% after. And so that's like not a fuzzy RD, because not everybody's on the program after, okay? So in that case, it would just be called a regression discontinuity. Here, instead, some share of people, like, you know, 12 to 14 to 15%, and it should be a higher number for those under 200% of poverty, but we can't do the administrative data regression. So I'm going to go back to that here. So the administrative data regression shows that there's about 15% of the children are on the program when they turn 5 and then they leave it. So implicitly, if you know, those are the people who should have been affected by this decline. So it's fuzzy because participation isn't going from 100% to 0, but rather from 15% to 0. So not everybody in the data that's under 200% of poverty is experiencing this discontinuous change when they turn 5. So hopefully that helped a little bit in terms of explaining it. Let me see if there's anything.
Oh, well, Marianne, why don't I jump in and I'll ask a question now.
Sure.
Maybe we'll see if other people have questions. And mine is maybe, a bit of, I guess, a question, but more also asking you to comment. And you've shown us, I think here, some of the things that one can do when one has access to the restricted NHANES data that one cannot do with public data. And I think that may pique the interest of some folks on the call. So if you could talk maybe just a little bit about what is the process of working with the restricted data? What are the things somebody needs to think about if they want to do a study with the restricted data?
So the first thing is that you need to have a co-author who's near the RDC. I think everybody at UCSF is near the Berkeley RDC. And if you have a Berkeley co-author, it's free to use. So that's a huge advantage for us here. Otherwise, a seat there costs $15,000 a year. It's much cheaper, I think, for graduate students. And I don't know who actually pays the full price, but it's something where there's this fixed cost. And that's because Berkeley has to pay for the cost of half of a census employee to run the place, and also some disclosure costs and that cost to sort of get people into the RDC. So then there's an application process where, they've recently changed this to be more standardized. It's not just NCHS looking at it anymore, but, you have to do a proposal, and it has to go through this centralized review, because you're using the data at the census RDC. If you wanted to just use the NCHS data, there are also two NCHS RDCs. One is in Hyattsville, Maryland, and I've used that one, and one is in Atlanta. And so if you did that, you would have to pay some other fee, but you would have to go there physically to use the data. So the advantage of the Berkeley one is it's local for all of us, or at least all of you who are at UCSF and me. And so in the things to think about are, sometimes it's tricky because they want you to sort of guess what you think your results are going to be and put that into the proposal before you actually know what's in the data. So we had also proposed to try to look at some policy things with the NHANES data, and there just aren't enough repeated cross sections to really look at all of them, the things we wanted to do in a DD design. So you have to think about, it's like a grant proposal, and you have to think about what are the outcomes you're going to look at afterwards. And then once you get it approved, you have to go into the RDC, which is, for those who've done it, it's fine, but it's a much more, it's not as smooth a process as working on things from your home. You have to physically go there to the RDC and work in there, and you can't take results out except sort of general patterns. You're allowed to think about what you remember, and then you have to get stuff disclosed, and then you can write up the paper. So if you wanted to do this for a quick turnaround grant, it would not be a good idea because it's not a speedy process. My personal experience has been that, to try to think really hard about exactly what it is you want to have at the end and be really precise about what the outcomes are you're going to look at, because how sometimes when you're doing research and you're like, I started off thinking I'd look at this thing, I want a small tweak. If you want to do a tweak of an approved project, you get 2 free modifications, then you have to pay $1,000. But much more important, there's this time lag, because you have to send it to the RDC, your analyst sends it to the people who work on the data. And I think the other piece, at least for this, I think it's less true for NHIS, but with NHANES, there's just a lot of details about the data that are just hard to figure out until you're physically in the RDC. Like this, we didn't know how many spillover people we would get. I think it could have been knowable that there was this sample design where, more kids sampled might mean fewer adults sampled, but I don't think that was very clear to us before we started. And then sometimes they just increasingly, there's these privacy concerns that, it's not just restricted to NCHS, the census is implementing this differential privacy stuff. So, for a different project where we had, month by year variation, we weren't allowed to control for month because there was concern that that would reveal something. So we could only control for quarter of interview in our regressions, even though, I don't know anything about differential privacy, except that it's going to make it a lot harder to use the ACS, but it's hard for me to see how that would lead to privacy violations, but it would have. And then I think the other thing is to just be ready for the idea that it could just take a long time. There's congestion at the RDC, you got to wait for your person to review it, et cetera.
Thank you very much, Marianne. That was all very helpful. Rita wrote in the Q&A, and Rita, I don't know that we can allow you to speak, but I will sort of channel what I thought I heard you say, which is if you are a researcher at UCSF, you can get access to the RDC free of charge. You do not need a Berkeley collaborator. UCSF is paid, I believe, paid the fee for you. So the cost isn't a barrier, but everything else that Marianne said is important to keep in mind. And I bring this not to discourage you at all, but just so that if you have ideas for projects or this restricted data, that you understand what the process is, you understand it's something that's going to take a long time, and that you factor that in deciding whether you want to pursue a project with the restricted data. I think it's better to know these things ahead of time than to find out the hard way.
Yeah, and it just, I mean, I think that because I have normally sitting in the econ department, it's fine if my papers take years to get published, so it's less bad than it would be if I was on the need to produce 5 to 8, whatever number of papers many of you produce, which I find awe-inspiring. But I think, it's I mean, we got some money from RWJ for this, and we're probably going to have to, get some kind of no cost extension, in part because the RDC was closed for a while because of COVID, but just in part because we've been a little unlucky with the whole process. And so, the data are super rich, but there are definitely some limitations with them.
Folks have any other questions? I'm going to take chair's prerogative and ask one more, and this is piggybacking on what both Marianne and Hillary have talked about in terms of extending eligibility for WIC until kids become eligible for school food programs, and putting on a policy hat. I think that makes a lot of sense in many ways. I guess the question, might be, what's the rationale for a school feeding program, given everything, Marianne, that you've said about summer and the challenges of summer, given that in a pandemic world, we are probably for the foreseeable future going to at least have some kids in and out of online school due to quarantines. Is there, different, I mean, is there some important out of the box thinking on how we address family food insecurity?
Well, I mean, there's some work by Lauren Bauer, Diane Chansenbach, Krista Ruffini, and I never can, Abby Pitts, and maybe somebody else. I don't remember who the other, I apologize that I can't remember the other co-author, but they were looking at the pandemic EBT program, which sent checks to people. Now they were, because of huge delays in when that money went out, because states had to, it wasn't even easy for states to figure out who was in closed schools and on SNAP. And then they had to devise a program for people who were getting school meals or eligible, like participating in school meals, but not on SNAP. And so that meant that even though schools closed in March, these payments were coming out the first year in like June and July and August. And they were non-trivial amounts of money, but they find a correlation in I think it's a quasi-experimental design of DD. So different places sent the money out at different times, and they find a decline in the measures of food insufficiency that are in pulse with this. Okay. So I think that program for sure worked, but I also think, there is not great support for giving more cash that's unrestricted to poor people in this country. There are a lot of concerns about that. That's part of why people love in-kind programs. But I also think, there probably is some value. There are people who are just too afraid to sign up for these programs because of concerns about immigration status. Maybe not so much now, but certainly a year ago, there were all these studies and anecdotal reports of people saying, I don't want to be in the program and, burn my records so that I don't get into trouble on public charge basis, even though nobody was ever talking about including WIC or I think school meals in the public charge. People were just afraid. And if you can show up and semi-anonymously pick up food, there are people you will probably reach. So I think there's a real debate here, because there's a set of people who are very skeptical of non-cash in-kind distribution systems. And yet, there was nothing else until states got their acts together to do pandemic EBT. So you need programs you can ramp up quickly and when times are bad. It's just like now we just got the poverty report, right? Poverty for 2020, actually supplemental poverty went down in part because of all these cash infusions, but with the exception of the economic impact payments, it took sometimes months for states
Yes.
to get the payments out. So there were all these people in need who couldn't get anything else.
Yep, and long
So-
lines
so
of food banks.
So I agree. I think there's still a role for some direct provision, but there's a set of people. I mean, as long as Joe Manchin's in charge, he's very concerned about giving people money for nothing. So I think there are these political economy challenges that get in the way.
Yes, well, thank you very much, Marianne. Always important to keep those political economy challenges and political realities in mind. Seeing no other questions, we're almost at time. I want to thank Marianne very much for her presentation. Really appreciating it. It was very enlightening, and we look forward to seeing the final papers as hopefully quickly as the RDC can give you approval to get things out.
Well, thank you very much for everyone who came. And again, if anyone has any other comments for us or thoughts about, knows more about NHANES in the background, please get in touch with me. My email is bitler@ucdavis.edu. And thanks again for coming, and thanks for a great sabbatical.
Okay, well, thank you so much, Marianne. Bye-bye, everyone.
Bye.